Hi, we are the reporter and representative of Group 1 Tesla that will discuss later on the understanding of coronavirus and how this virus can be transmitted and prevented, particularly at home and in school. So, what is COVID-19? Coronavirus disease 2019, also called COVID-19, is caused by a virus that can pass from one person to another. It first appeared in people in December 2019 and has quickly spread around the world. COVID-19 affects your respiratory system. In some cases, it can cause problems with your lungs like pneumonia. Guidelines and recommendations are changing quickly as we learn more about the virus and how it acts. Trying to keep up with what to do and what not to do can be confusing and overwhelming. Let's talk about what is going on and what practical steps you can take to keep you and those around you safe and healthy. How does COVID-19 spread? The virus spread through droplets. So, when an infected person coughs or sneezes, they can project droplets of the virus out into the air. Those droplets then land on or breathed in by other people is the common way the virus can spread. It can spread when those infected droplets land on surfaces like door, handles, and elevator buttons. If a healthy person touches the surface that has droplets on it and then touches their eyes, nose, or mouth, it's possible for them to get infected. These are gateways for the virus to enter your body, so the less you touch things that are commonly touched by others, the less possibility for the virus to enter your body. That's why the LGU keep reminding us to always sanitize. Moreover, it may be possible for a person with COVID-19 to pass the virus to others when they are not showing signs of being sick. This is called asymptomatic transmission. It often takes to 2 to 14 days before people start to feel sick after being exposed to the virus. So, you could be getting other people sick without knowing it. That's why, when there are a lot of cases of COVID-19 in an area, leaders recommend staying home unless you really need to do something like groceries. And if you are feeling sick, stay at home and call your doctor.
What are COVID 19 symptoms? Some signs of being sick with COVID 19 are fever, cough, body aches, and trouble breathing. Some less common symptoms of the virus includes headache, sore throat, runny nose, problem with sense of smell or taste, nausea, and diarrhea. I know it can seem like anything can be a symptom. So if you aren't feeling well, stay at home and call a doctor. Most people who get the virus will experience mild symptoms. Some people won't experience any symptoms at all. Most people, including children who get sick with COVID-19, can recover at home. But for some people, especially people who are 65 and above, who have other health problems like lung conditions, diabetes, and heart disease, and for people whose immune system or infection fighting system doesn't work so well, COVID-19 may lead to more serious problems that require hospitalizations. What should I do if I'm feeling sick? Sick. If you are feeling sick, have a fever, cough, or having trouble breathing, call your doctor or local urgent care facility. This is important. Call first, and if you are sick, cover your nose and mouth with a cloth mask, scarf, or handkerchief. It will it will help protect the people around you. Also, check with your National Health Agency on mask recommendations. When you call, your doctor can tell you what to do next. Some people may need to come in and be seen by a doctor, and some people may need to stay at home and limit their contact with other people. Your doctor can tell you what you should do. What should I do if I'm worried I've been exposed? your chances of exposure to the virus that causes COVID-19 increase. If you are within 6 feet of someone who is infected, about the length of a bed, away from them, you live in or have traveled to a location that has a lot of cases of, or you were at a crowded event with someone who is infected like a party. If you think you've been exposed to someone who has COVID-19 but aren't having any symptoms, call your doctor, hospital, local urgent care facility, or public health office. They can tell you what to do next. If you think you might have been exposed and you have symptoms like fever or cough, you should call before going to your doctor's office or to a hospital. Your doctor can tell you what to do and if you need to be seen in person. If are asked to come to the hospital, you may be asked to follow special procedures like using a special entrance away from other people and cover your nose and mouth. It's to know that currently there is no proven treatment for COVID-19, but doctors can help support your breathing and make you as comfortable as possible. Most people will not need to stay in the hospital and will be able to make a complete recovery at home.
What can I do to stay healthy? Wash your hands with soap and water. Really, I know it sounds simple, but it has a big impact. Basically, it's because soap break apart the container that hold the virus. Once the container is open, the virus just washes away with the water. For this to happen, you're gonna end some time washing your hands and you need to scrub. You want to wash your hands for 20 seconds. That's the happy birthday song 2 times. You want to rub your hands together, clean your wrists, fingernails in between your fingers, and dry your hands with a paper towel you can throw away. Lastly, turn water off using the paper towel instead of your hands. Now, if you have kids in your household, make sure they're washing their hands this way too. If you aren't around soap and water, use hand sanitizer that at least 60% alcohol. Make sure to rub it until it's dry. What else can you do to stay healthy? You want to keep your distance from other people. This is called social distancing, and you really want to stay away from people who are visible sick or coughing. If you can work from home, and speaking of home, clean surfaces that you use frequently, clean doorknobs, countertops, your phone screen, and other item you touch a lot. Lastly, it is a good idea to limit travel to places that have a lot of COVID-19 cases. Okay, let's talk for a quick minute about what doesn't help protect you against COVID-19. It doesn't help you to hold your breath if someone sneezes or cough around you. The virus can be passed multiple ways, so not breathing around people doesn't really do anything.
Let's also talk about masks. As long as very contagious variants of the coronavirus like Omicron keep prolonging the pandemic, masks remain an important way to stay safer in certain situations. Depending on the spread of COVID-19, officials will continue to update mask guidance as needed. So make sure you're up to date on which masks offer you the most protection and when it's a good idea to wear them. Face masks won't totally block the coronavirus, but some like the N95 comes very close. A mask gives an added layer protection to you and the people around you. Surgical masks, also called disposable masks, are often blue with white borders. These masks shields against the large droplets that come from a sick person's cough or sneeze, but they're too loose to protect against all germs, and they can block the tiniest particles that may carry the coronavirus. Cloth masks are washable and reusable. They're not the best option, but they do give you protection and are better than wearing no mask. The best cloth masks have multiple layers of breathable fabric and fit snugly over your nose and mouth. It's a good idea to buy ones that come with a nose wire and are made with fabric that can block light. It still depends on where you live and what you do there. Many state and local governments have loosened the rules about face masks in public places. Workers in certain businesses may still have to mask up because they're in constant close contact with others. Masks are also still required on all forms of public transportation, such as planes, buses, and trains.
How can I help slow the spread? I know COVID-19 sounds scary, but there are some good things to keep in mind. For most people, COVID-19 is a mild infection that is not threatening. You can do a lot to keep yourself and others healthy by washing your hands, staying away from people who are sick, wearing a face covering, and practicing social distancing. Remember, if you're feeling sick, stay home and call your doctor. By taking these practical steps, you can protect yourself and those people around you and help slow the spread of the virus. And you can stay up to date with the latest guidelines and recommendations at or Tour National Health Agency on issuances on COVID-19 prevention and